BPH is benign prostatic hyperplasia. It is a non-cancerous growth that affects older men. Men over the age of 50 years old will start to experience some prostatic symptoms. Prostate cancer, on the other hand, is different. It is a cancer that affects the prostate gland. This also occurs usually in men above the age of 50 years old, and it is the third most common cancer in Malaysia. The symptoms caused by BPH can be divided into two categories. The first is irritative symptoms. For example, frequent urination, an urgent feeling to urinate, having to wake up at night to pass urine, and in the worst case, urinary incontinence, which means leaking of urine. The other group of symptoms are obstructive symptoms. For example, a difficulty to initiate urination, a poor urine stream, starting and stopping urination in between, and also a feeling of incomplete bladder emptying. Usually when a patient with BPH comes to see me, I will first take a detailed history about his condition, followed by a physical examination, which includes a digital rectal examination. After that, I will do a uroflowmetry, which is a test that determines the patient's urine flow. I will also do an ultrasound to determine the prostate size, and following that, most of the time I do a PSA test as well, which is prostate-specific antigen aimed at screening for prostate cancer. For patients diagnosed with BPH, I usually start treatment with lifestyle modifications. For example, fluid intake modification, reduction in caffeine, general exercise, which may or may not include pelvic floor exercises. For those with more severe symptoms, I would recommend starting medications. There are two types of medications for BPH. The first is alpha blockers. This works by relaxing the prostate muscle so that it improves the urine flow. The other group of medications are called 5-alpha reductase inhibitors, and this is suitable for men with larger prostates. This medication acts by reducing the size of the prostate and also achieves the same effect, giving a better urine flow. Surgery might be a better option for patients with BPH symptoms when either they refuse to try medications or they fail medical therapy, which means that despite an adequate duration of medical therapy, their symptoms do not improve or even get worse. There are a few absolute indications for surgery in cases of BPH. For example, the patient has recurrent urinary retention, patient has bladder stone, or has kidney failure as a result of obstructed urination. The most common surgery done for BPH is called TURP. TURP is a form of minimally invasive surgery involving the use of an endoscope inserted through the urethra. In this surgery, parts of the prostate are resected to allow a better urine flow. Another procedure which is quite similar is called laser enucleation of the prostate. This surgery is suitable for very large prostate sizes. Now we have newer technology, for example, water vapor therapy and microwave therapy, which is aimed at treating smaller prostate sizes. Another option for patients with extremely large prostates is robotic surgery. Through robotic surgery, we're able to remove the entire prostate through a minimally invasive technique, which involves only small incisions made in the abdomen. Because of these small incisions, the patient will experience much less pain, a quicker recovery to normal activity, and a faster discharge from hospital. If you have some of these symptoms, or if you have a family history of BPH or prostate cancer, do come and consult us at Sunway Medical Center. Don't suffer in silence. We may be able to help you.